Welcome back to Uncharted Narratives. Today, I'm joined by Dr. Audrey Durrant, an international trained physician who's been fighting to reclaim her calling in Canada's healthcare system. With heartbreaking honesty, she shares, "I miss being a doctor." Dr. Durrant pulls back the curtain on the credentialing nightmares, systemic barriers, and well-being toll that newcomers face. Challenges she knows too well as she prepares to practice in Regina, Saskatchewan. From AI's potential to cut through red tape to the urgent need for cultural sensitivity and data-driven equity, Audrey's not just sharing her story. She's demanding systemic change for all foreign-trained physicians. This raw conversation about diversity, innovation, and second chances is for every healthcare leader who wants a better system. Let's dive in.
Good morning. How are you, Audrey?
I'm good. How are you?
Not bad. You have a guest with you.
I do have a guest anytime I sit down for more than 5 minutes, and especially if we're on Zoom, because he knows I am trapped in the spot. The other family member, my other son, Baxter, appears. So every once in a while, if you see a little furry head,
he, he is or she is.
it's a he, and it is the price of admission to spend time with me on this forum comes with dog.
Yeah, okay. So he is very jealous. So, Dr. Dory, thank you for giving me the time and be with us today. So, you been known as an advocate for all the newcomer, and you have passion to improve the healthcare system. So, in nutshell, if you want to give us who you are, what you are doing.
That is quite a nut. So I am a board certified pediatric surgeon. I was born in Jamaica, grew up in Toronto. I knew that I wanted to do a particularly selective field of medicine, so did undergrad here in Canada at McMaster, and then did the rest of my training, medical school, residency, fellowship, all in the United States. And if you have not been living under a rock over the last 2 years, you have seen that the United States is going through some sort of teenage rebellion, and its representative democracy is now shifting into an autocracy. And right around that time, a family member got sick, and it seemed like the universe was telling me that it was time to come home to Toronto, to Canada, to repatriate. I then was connected with a position in Saskatchewan, some part of Canada I've never been in, but it seemed like a good opportunity to put my foot back into Canadian medicine. That was in June of this year. I just finished getting my credentials verified by the Canadian Medical Board, I would say about 3 weeks ago. And it was the most frustrating process I have ever been through. And that is someone who has 10 licenses for various states in the United States, including Florida and Texas, which are incredibly difficult to get, in addition to being credentialed to practice medicine in the UAE.
First of all, congratulations for having, and you get it. We will touch base with this, and for sure, this is where we today and we connect to discuss all the challenges a newcomer they face. And regardless of your number of certificates, credentials out of the Canada, it's like they overlook everything and just they looking for that. Speaking about the challenges, could you please tell us about the challenges personally you face as a common in newcomer they have it? So you mentioned the timeline and how it's frustrated. Anything the newcomer that they don't know about it, because something is common and something is based on case by case. So what happened with you?
So one issue that definitely I would imagine frustrating is that as physicians, as anyone in healthcare, you want to have autonomy. You want to be able to fix things. We're fixers. That's why we went into the medical field. But the Medical Council of Canada puts up so many barriers to prevent the candidate from affecting change. You can't talk to anybody. Nobody takes ownership. Who do you talk to? When things don't go right, can you say, did you do your job? You can't get a name. You can't get a number. Nobody really wants to take ownership of the process. So you're constantly going around in circles, and you're constantly having to retell the same story over and over again. I at least had the luxury of, this is my home and my family is here, so I can be a bum on my mother's couch, but I couldn't imagine having to go through this process as somebody who has family and responsibilities and children that they need to raise and feed, because kids don't understand that the parent that used to be the breadwinner and could make all of their dreams come true can't even make day-to-day cereal, toys, their regular life continue. Kids don't understand those things. I don't understand those things.
But from outside perspective, Canada try to attract all high profile, well educated, talented to come here. So when they bring them here, why the system keep them struggling?
That is a question I don't understand, because they put out these signs that say that there's a doctor shortage. We really want you to come here. But then when you come here, they don't facilitate the process. Now, my understanding is that Alberta has recognized that this is an issue and has begun a process to fast track foreign trained physicians. But nevertheless, that's one out of all of our provinces. And the process really shouldn't be this onerous for someone who's trained in the United States. There are people right now who travel between the United States and Canada every day for work. So why my training in the United States shouldn't be treated as equally quotidian, I don't understand.
Yeah, and I see when I came to Canada, I thought Canadian is part from the Commonwealth, so they were following the UK. But I realized they copy paste the US, and I got shocked when they don't recognize the education in the US. You copy the US in everything, single things. But in reality, when you come here, you try to build your system, your setup, what is good. But for me, for someone who work in different country, I never see a healthcare system or hospital use fax till now, except in Canada. So if you want to promote and sell your experience, that means you are outstanding from the other, but you are not. This is the issue. You are not. You are behind. So
Yes.
you mentioned you are certified and you have your credential from Dubai. So in the GCC, they are way beyond in the technology and in the system improvement compared with the Canada. However, the investment and human resource is less than Canadian system. So this is will give me the indication if the numbers tell me Canada take the advantage from investment and all the resources they have compared with the other, but they are behind. So the issue with the leadership. Let's put it in this way.
It is, but who do you talk to? Who is the leadership that you can talk to? Because you can imagine that when my family was like, oh, well, things are difficult, why don't you talk to your local representative? My local representative was like, I can't help you.
Mm.
So they didn't even give me a where do you go is the next step. I've been a Canadian since I was 3 years old, and I immediately felt like a foreigner in my own home country.
Very bad. So speaking in this, do you think those challenges and hurdles of getting the credentials as a role block impacts the newcomer well-being and career, not only career, also the well-being?
Absolutely. How can it not? How can you not go from someone who is making life death decisions to somebody who can't even take care of their activities of daily living, can't even guarantee that they will be able to do Maslow's hierarchy, food, shelter, clothing. And then as a parent, it becomes even more painful to have to try to watch your children suffer because you can't fulfill your responsibilities as a parent.
So you mentioned it was very lengthy process for you to get your credentials here. So how you keep motivate yourself and stay every day up and willing to work?
Thank goodness for coffee. Um, but I had a side project. I have White Coat Green Room, which is my blog, which allows me to complain to a lot of people and find other people who agree with me, because obviously it's all about being in an echo chamber. And at the same time, I'm also developing a health tech company. But nevertheless, this is the thing that I spent 13 years training for. I miss being a doctor. It defines my identity. That probably is something I need to talk to my therapist with. But nevertheless, it is something that is core to who I am, and not being able to live that part of my life feels like a part of my body has been cut off.
I see. So while you are still building different strategy or goals still you are attached to be a doctor, which is something is this is why you came here and why you want to improve the system, and this is where the whole Canadian system they are bragging we need doctor, we need doctor. So there is no harm from this, but while you are doing very good projects and initiatives, still you are attached with the to be a physician. One thing here you mentioned you building your healthcare tech company. Can you please elaborate more here about that? I like doctor when they are thinking about technology. This is the first time I know that from you.
So I fortunately had the privilege of doing my residency with Hassan Teta, who is big on AI and medicine. He did part of his training in the military, and they are very face forward in tech and have the ability to see that AI is coming and it will be a part of medicine. And as a minority woman, as a part of the global majority, if we do not involve ourselves in what's going to be making healthcare decisions for us the next 30, 40 years, we won't be part of the picture. And so for me, I saw that I had people coming to me asking, do you know a Black female OB? Or do you know a doctor who looks like me, who speaks my language? And I realized that this was a need that was not being met. That we know that patients, when they culturally match their healthcare provider, speak their same language, have the same experiences, they have better outcomes. So we have an information technology out there that should be able to let us have that information. So I created an app that lets you get a bespoke physician request. So do you need a female speaking cardiologist, a female Spanish speaking cardiologist in Park Slope? Well, then you can put that in, and as much as we can, if that person exists, you should be able to go to see them.
Yeah, I totally agree with this. This is something is not considered in any platform to check about the language or background or not giving the weight which the people they needed. But here, out of the technology, it came to my mind. I'm trying to be the opposite side of what you are saying. So, however, that doesn't mean I don't agree with you. So, Canada intended to be diverse and to have that tissue of the community as a one unit. So, what the purpose or what the goal of having your technology in order not to be engaged and involved with the Canadian system? So, no need to think about your background or maybe languages is okay for that, but at least we are one system. So this is something you will not unify or union the community. This is will keep the newcomer isolated and separated, which we don't want. We want to engage them. How you see this?
I don't see that as isolating, because for every person that comes that's representative of the diversity, there are patients out there that need that, or who wouldn't get the care that they need to get because they can't speak the same language, or for whatever reason, the healthcare provider doesn't appreciate the severity of that factor in their lives. For African Americans or African Canadians, it's sickle cell disease. Whether you have it or are a carrier, the way that it presents, the needs that you have are very specific. And unfortunately, as much as I'd like to say that we all don't see color and we don't see those cultural issues, the reality is we do. We've all been indoctrinated in the same cultural background, and we all have prejudices and things that we have in the back of our minds, whether or not we realize it. Even I sometimes cross the street if I see somebody that I think looks dangerous, and maybe to their own culture, that looks perfectly normal, right? And until I recognize that I have these prejudices, I won't be able to address them. But that cultural sensitivity is not something that needs to affect your medical outcome. That's something I need to work on in my private time.
I agree with you. This is what I told you. That doesn't mean I don't agree with you when I ask you. And does
I
it just
understand.
happened with my wife when she went and admitted for in the hospital for delivery. So the anesthesiologist it's male and she want female, especially when
Yeah,
she put the epidural. And this request was denied because this is what we have. So sometimes not necessarily the culture, sometimes the preferences. Women like women to stay with them, especially
absolutely.
in very close and sensitive areas like delivery. So some women they don't like doctor to be as a OB-GYN. She prefer female, and this is should be understood in this
That
way.
should be your right. Absolutely, especially at that point when you're giving birth to a child. Absolutely. If I want Stevie Wonder piping through you give it to me. I mean, it makes the outcome better for me and for the child. I don't see the downside.
Sounds good. So here we discuss more about the diversity, and you mentioned also about your tech system. So because now you being part from the system, and you are advocate with the technology, and you also I see you as an entrepreneurial folk and working more into technology. So how you see the entrepreneurial technology will break down those barriers in the Canadian system and improve the newcomer experience?
Whoa, that is a big question. Well, on a personal level, the reality is I have an active field in medicine. I have to use my hands. At some point, even though black don't crack, it eventually will get old. And at some point, I may not be able to operate as well. And I probably shouldn't be in the operating room at 99 like DeBakey. But I believe my mind will still be working. And being an entrepreneur means that I'm planning for that future when I'm retired from the OR, but still am vital and want to be part of the system. And we really should have a way to keep that older generation, I can't believe I'm describing myself as thus, within the system, because they have a huge wealth of knowledge, and we want to make sure that that gets cycled back to the new people coming through, that the information, the knowledge, all of that just continues to grow and doesn't get retired along with the individual. I haven't 100% figured out how to incorporate that into the Canadian life, but from what I'm hearing from so many people is even though they love the idea of socialized medicine and how much healthcare they get on an individual level, there are some things that they're just not able to get, and so they do access the US system. So I think that will be how I will introduce it into the Canadian system. But ultimately, there needs to be more choice in the Canadian system as well.
And when they approach, just for everyone not aware, Canada provide a free healthcare. So because it is free, they stay ages. So they decided the patient to travel abroad and pay from their pockets to get the treatment because they cannot take it in their home for free. So this is where we label every time we have a universal healthcare system, and it is free, but we don't have access on it.
You don't have access to everything that you need.
Yeah.
And again, I think of it like Walmart. You know, if you had your ability to get everything, you'd stay in one spot. But sometimes the better stuff is at the higher end.
So, from what role can newcomer as a healthcare profession play in order to reshape the environment or the care environment, and also bring more innovation? And you were also advocate a lot about equity and inclusive. So, how they can reshape or shaping Canadian system Canadian with inclusive and innovation initiative?
See, part of the issue for me is that I've actually never practiced in the Canadian system. I've always been in the United States. In the US, I'm the Canadian. When I'm here now in Canada, I realize I'm being seen as the American. But what I do know about Canada, because I've been trying to do my research, is that we don't collect the data. And because we don't collect the data, we can't address the problem. We don't know about infant mortality in minority groups. We don't know about health outcomes stratified based on ethnicity and culture. And since we don't have that information, we can't address the issues. The reality is the United States casts a very large shadow, and we can't believe that the problems that they have not affected Canada. But again, since we don't measure it, we don't have to address it.
I'm surprised. I thought there's the CIHI. They collect all those number from all province
Try to
and
find
put
it.
it. Not?
No.
Mm.
Try to find, maternal mortality rates for Black women in Canada. You won't find that data.
Okay, so yeah, you mean they collect, but they do not collect all the KPI which we need to measure it in order to improve our system. So this is
Right.
one of the things. However, Canadian, they promote themselves as a equity and inclusive. When you want to know the mortality rate with the Black women, there is no data.
There's no data, but let's not take away from what Canada is like. You do come here, you don't feel the oppressiveness. It isn't your first identity. I wrote once in my blog that I became a Black woman when I crossed the border. It became the first way that I was described. And you definitely feel the difference. Even when you just go to the store, all of a sudden people are watching you. Not because you're a pretty girl, but because you're a Black woman, and somehow you become a risk.
You are pretty girl.
Yeah, I was just trying to get compliments. Okay.
Okay. So now let's move a little bit more into the technology, and we start to hear a lot AI everywhere. So it's like right now fear of missing out. If I don't know AI, that mean I will be out. And you mentioned something like this, which is something absolutely right. We need to evolve and to follow the technology and trends. But are we following it the right way? Are we talking about something that we need, or just to follow the trend without understanding what that means? There is a fear that AI will replace the physicians and doctor. What you're saying in this?
It's like the World Wide Web. When the internet first came about, or when personal computers first came, everyone was like, oh, that's cute, but that's not something that I'm going to be doing. Right now, I have Echo in my home, and it's like the other parent. My son fact checks me when I tell him things. When I grew up, it used to be, oh, go look it up. Go read about that if you want the answer to it. It's here whether you want to accept it or not, because every time you ask Siri how to get to the movies, you're engaging with AI. So accept it and learn how to use it. If you don't, it will pass you by. And it's learning. So each time you ask it for something, you're telling it what's important to you, what's important to your culture, which is why I say with my app, Inclusive AI or Inclusive Match, what it does every time you ask for a Black female pediatric surgeon, you're telling AI that these group of humans, they need doctors that are Black, they need doctors that are women, they need Black female surgeons. We need more of these. You're training it. If you don't train it, it will say, we don't need that. And it will be making healthcare decisions for the next 40 and 50 years. And you will look up one day and realize all the doctors are old white men. I don't want that.
Me too.
Nothing against my grandfather, who's an old white man, but nevertheless, that's not the only choice I want.
Absolutely, especially Canada have advantage of accepting everyone. So
Yes.
as a system outside, this is where they want. But the issue with the union and a professional entity, those were both the restriction for the newcomer. So there is no harm. I never feel home like Canada. I feel I am home everywhere when I go outside. There is no issue with the Canadian culture. The issue
Right.
with the professional system keep preventing you and say you are not qualified, you are not. So you work in US with known as one of the top healthcare system, and still they are very picky in choosing their doctor and their nurses, and you did a great job. But when you cross the border, you come as a normal citizen, like you are not qualified enough for Canadian. So it's disheartening.
The issue is that even though you look around Canada and your friends are Yasmin, Keiko, and Chad, the people who are still making decisions, the honor walls in hospitals, they very homogeneous. And until the decision makers, the people at the table in tech, in healthcare, in science are as diverse as our population, you're going to still feel that coldness.
Yeah, you remind me. I was part from a company, so my manager told us that one came to the company and had an interview. So they decided to ask something out of the book for the candidate. So ask the candidate how you see us from the outside, how you see the company. So he answered in very respect way and honest way. I see
Yes.
it's bunch of mid-age white people. They are in the leadership,
A little too honest. Okay.
and this is the fact. All the leadership they are white, and they got surprised. The issue they got surprised, and the HR start to do a lot of the initiative. Fast forward 3-4 years, still they are white in the board. They are white in the leadership. So yeah, sometimes not intended that you have the passion or you have the intention to do that will have the result. Still, there is deep side system. It's very hard to do that, and I can see this in Canada with Adam mentioned the name. Sometimes you can go for store, you can go for all of them white cluster, but the way you see it outside, everyone are welcome, and this is something is not there. So this is not the topic which I try to focus on it, but I try to see, okay, if we will adopt the high technology and AI, do you see this is will open a new opportunity for a newcomer speaking in the same obstacles and barriers, or this is will add additional barriers for the newcomer to get into the system?
I don't think it's going to add barriers per se, but if we just translate our current culture into AI, it will have the negative effect of magnifying all the prejudices that are already baked into our current system into an AI system that will scale it to a point that we won't be able to take it out of the water. Now, as AI systems are being developed, this is when diversity is the most important. This is when the table needs to look like the rest of Canadian society, and everybody needs to have input. Otherwise, what we will end up with is our old systems now computerized.
I have a question for you. So you are advocate and you are futuristic about the healthcare and technology, and you work hard and you have the buy-in. But what about the doctor who are not young like you? They are very afraid from technology and they have the resistance. So if I want to hear this from you from physician perspective, how can the hospital and the system improve the technology which will be used by physician, but the physician they don't want to change?
This is the same issue we had when minimally invasive surgery started. We still have surgeons who, oh, I can do a perfectly good open appendectomy. I don't need to learn how to do a laparoscopic appendectomy. The reality is the demand forced the change. As in, our patients were coming in saying, I want to have surgery and have a little tiny scar like that. Absolutely, you need to know how to do an open, but if you wanted to serve your population the way they needed to be served, then you needed to learn how to do laparoscopic surgery. I think part of the fear of AI is that it comes to us with two frameworks in place. One, we all saw Terminator. We're all waiting for Skynet to kill us, right? And then second is the, oh, AI is going to take your job, right? So if I get involved with AI, then I'm just going to teach AI how to do my job. Well, I'm sorry, do you want to be operated on by an AI surgeon? No. All right. So the reality is what you have to learn to do is learn how to use AI. And once you learn how to master it, then you're at the forefront of the new changes that go on, and they need you.
Absolutely. No one. I try to put my question. So if I am a patient, I will know any impact, and I will request from the doctor. I need small scar or use this. But I, as a patient, I don't know what technology they use in the hospital and whether it is high tech or not. So I don't care. So if the patient not giving the demand which you talk about it, what will create the demand for the physicians in order to adopt and be part from this change?
You know, there are always going to be Luddites, people who fear technology. And I don't believe that dragging people kicking and screaming to someplace they're not comfortable is good healthcare. There are those who are going to be early adopters. I've been an early adopter my whole life. And those are the people that you speak to and hope that their enthusiasm will bring the others with them. But you never effect change with force.
Okay. So why you as a personal you are passionate about technology and you are in the technology, however you are pure medical background?
You know, it's just something I think I've always been fascinated by. Everybody has something that the problem with medicine is everyone assumes that that's all you do, right? And so they go, so what do you do in your free time? And your first thought is, I have free time? But the reality is that this possibilities for AI and all the things that it can let you do in this world are endless. And I'm a mother, so I have my own version of endless possibilities growing up in front of me. And I want to be part of his world. And his world is going to involve AI. It already involves the other parent named Siri, who's always back talking me. So unless I'm able to engage, interact with that, my whole patient population is going to go by. I'm peds, and they live with technology. I can be operating, and they would be happy to allow me to do it if they could use their iPhone and probably ask for less pain medication, right? So that are the people I talk to, and that's what they're involved in. And if I want to be able to talk to them, I need to be able to talk AI and tech and everything that's in their world right now.
Do you think those technology and AI in the future will play a role in order to be more prevention than a treatment for disease? So this is where the medicine came to be preventional and not to visit the hospital until I have an issue. This is what happened right now. So do you think that technology will help us to be more healthier and live more with the good shape and good health in the future by using those technology, and only the one who need the real treatment will visit the hospital, and those will be very rare? Is this something what you picture in the future, or still we are far away from this?
I think we are far away from that, but I do see that in the future. What we are seeing now is more concierge medicine, more individually specific medicine. People know their DNA, they know what their risk factors are, and so that medicine can be tailored to the individual. And I think the end result will be increased longevity and better baseline health. I'd like to believe that's where we're going, but a lot of people mortgage their future for their present life. So they drink more than they should. They don't exercise enough. They think in the future, later on, I'll do those things. But the investment that they make now is what's going to pay off big in the end.
Absolutely. So that is two ways. So this is for the healthcare profession, and also as a normal people, they need as not specialize on the healthcare. They need also to take care and use the AI for health future and longevity in order to enhance their future and stay away from the hospital. They don't want to go for the Canadian hospital at all. So can you tell me one story or anything how those challenges shape your leadership, your innovation thinking, and also how you become as a healthcare advocate?
So I came to Illinois to work at Carle Foundation Hospital, which was someplace that during the pandemic, they were the first ones to come up with the cheek swab as a way of diagnosis, as opposed to that invasive thing up your nose. I assumed that they were early adopters. When I came for my interview, I did notice that they had only one surgeon. She was working by herself, and for the most part, they filled their roster with locums, which is what I was working at the time. But that locum was somewhat of a Luddite, was doing things very old school, and I saw the practice gaps. And I remember being at the interview and saying to them, listen, I've noticed you guys have some practice gaps, things that we don't do as, standard of care. Are you okay with me making changes? They said, absolutely. We want to be innovative. This is also where the University of Illinois is, their Champaign campus. This is where YouTube, the founders, went to university. So I thought I was entering a land with my people. I got there. I was there for maybe 6 months before I got called the office and told that they had some concerns with how I practiced medicine. And they told me that a baby cried when I did a circumcision. And the nurse had asked me to stop, and they thought it was rude that I didn't stop. And the baby cried because I didn't give enough pain medication. I've been doing this type of circumcision since I was an intern, and that was 25 years. And anybody knows, once you cut skin, you don't stop. You got to finish, right? Then I did a sutureless gastroschisis closure, which a gastroschisis is when the baby is born with their intestines on the outside. And I don't give narcotics to children, especially not a newborn. So I did the procedure where you push the intestines back into the belly and just slap on a Duoderm and you let God do his work or her work. And I used just rectal Tylenol, knowing that if the baby's uncomfortable, baby's going to push and you're not going to be able to do what you need to do. So baby pushes, I know that I'm not giving them enough pain medication. If they let me do the procedure, we're all happy, right? The nurses wrote me up because they said that their surgeon gives fentanyl. I was horrified. that would immediately require the baby to be intubated. I said, you know what? You guys don't know how to do pediatric surgery. You need to send these cases out and get them reviewed by practicing surgeons so you understand how things done. They didn't. They put me on probation while they investigated. I sent the cases out to be reviewed by my mentors, and they came back like, Audrey, why are you sending that? This is nothing happened. No patient complaints, no negative outcomes. Why are we look? I said, they put me on probation. You gotta, So ultimately, long story short, I just accepted the severance from them, and I learned that Carl had a history of putting Black physicians on probation, on censure, and dinging their national physician database, which is a repository of information that is supposed to be not allow bad physicians to move from hospital to hospital, but anything can go on your national physician database. And what went on my physician database was that I left while under investigation because that was the only way they would let me leave. That mark on my national physician database made it nearly impossible for me to get a job. Even though I didn't have any malpractice, I had national awards, but that ding on my national physician database was making me impossible to hire. I was like, this can't be happening to me. So I wrote about what happened to me on Facebook, and I got almost 500 responses from physicians saying the exact same thing had happened to them. Fake peer review, this physician review, getting dinged, and then not being able to work again. And I realized that this was an epidemic, and I had to do something about it.
Wow, I'm not expecting this answer, to be honest. So
No one ever is.
I don't. So yeah, it is real example how you need to break this stereotype, and this is mafia
Yes.
of fake some of finding in order to exclude some of people. So you mentioned the review. So do you believe the mortality and morbidity review on the hospital, it's really meant to learn from the mistake and enhance the medical practice, or to use as a dirty tool like what happened with you?
In its essence, as a surgeon, we all have M&M, right? The idea is that you go back, you look at your near misses, you look at the ones that were, and I do believe inherently it was meant to be a review system to make sure that we don't make the same mistake again. The reality is that all things can be used against you if the system wants it to be. If they want to take that information, you can always find somebody who says, well, I would have done it differently. Absolutely, you would have done it differently. But is it necessarily wrong? We all trained in different places. We all learned how to do things a certain way. And I've always said, if there was a right way to do something, we'd all do it the exact same way.
How we can make sure of those review and meetings to have what intended to have on improving the practice and prevent any near misses or any serious incident in the future. So from your perspective, what is your recommendation in order for the hospital to implement the right way of it?
Well, first of all, there needs to be that is something that I think that we should continue. They should still remain private, not anything that can be accessible for litigation. But most importantly, I think that the National Physician Database, which was intended to be something that the public could access to find out about what their physicians did or didn't do, malpractice, it needs to be eliminated because now it's been weaponized by groups for fake peer review. It's used to keep physicians out of the hospital. And there are physicians right now who have sexual harassments, who have killed patients that don't show up on the National Physician Database because the decision to put a physician on the National Physician Database is purely up to the hospital. They can decide to put you on or they can decide not to put you on. There's nobody policing who puts them on and why they put them on. And as a result, it is used to keep a significant portion of physicians down. And if you take a look at them, a lot of them are brown and Black.
So back for something you mentioned here, sexual harassment and sometimes error lead for death. Why those is not mentioned in the national database?
Because it's only up to the hospital. So if the hospital doesn't want to report it to the National Physician Database, it doesn't.
But why the hospital will not report it?
Because they want to protect the physician. I had a bad boss who was fired and when we looked back at his history, he'd been fired from several hospitals, but no hospital wanted to be the one to prevent him from being able to get his next job. So they just pushed him on to the next hospital to figure it out. Now, he should have been reported to the National Physician Database for his disruptive behavior, but he never was because the hospital chose not to do so.
Because they are afraid from him, or they
No, because it was the old boys network. Old boys taking care of each other.
very bad. So I feel sorry. I've been in this situation. In as a nursing perspective, and
Yep.
I came across someone drug addicted, where they steal the narcotic from the patient and inject himself, and we are not aware until we discover that. But when we discover that, we realize this is not the first time, and none of those hospitals report that. So
Yep.
I know such as a story, which is very bad to have it. So as a closing thoughts, what you think the future should be and how we can improve? And this is not a structure, it's up to you from your perspective. As a you play as a patient in the Canadian system, you play as a physicians and surgeon, and also have different perspective from different country. So if we need to sit right now today and really give a sincere recommendation from the outside for the decision maker who cannot take right decision in Canada, what is your recommendation for them from your perspective?
Right now, I think this is a very good time for the Canadian medical system. There are a lot of physicians in the United States looking to get out. It's very unstable. And to have a system that is more accepting of foreign physicians, that fast tracks them to allow them to get back to work and to really put like a workforce behind it. I got the sense every time I called the Canadian Medical Board that they just didn't have enough people there to do the work. And as a result, it was not getting done. And there was nobody taking ownership of it. And technology can help them. This is where AI can help. And this sort of faceless documentation verification. This is where you can use the technology to make your lives better and put the people face front to other people so they can answer the questions while in the background the computer is doing all that heavy lifting paperwork that is drudgery and uncomfortable and that nobody wants to do. And the reality is medicine's only going to get better when everybody gets to have a say in how it moves forward. If the person that you sit next to has the exact same experience as you, they're not going to give you a perspective, and you're not going to be able to fix the bleeding you can't see because it's never been part of your experience, and the patient's going to die.
Yeah, sorry for that. And the good news, you get your license finally. So what is your plan? Where you want to practice right now in Canada?
Right now, it looks like I'm going to Regina.
To where?
Regina.
Where is Regina? Oh, okay, okay. So you will leave Ontario and you will go for Saskatchewan.
Yep. I'm
Too
going to see a
cold
whole
there.
new part of the world.
Yeah, it's too cold there.
There are always planes. There's always someplace warm to be.
Oh.
But the idea of being in an environment where patients need me and to just start a new adventure. World is small and life is short.
The reality, Audrey, we need a brave woman like you, a brave physician like you, who can stand and fight for their patient and for their life and for their family. Because if everyone came to Canada, if everyone come to Canada and give up, this is not what we intended. And when we connected because for the story where lady, she is on dermatologist, she is a dermatologist, and she is doing housekeeping because she in need for the money. So we are killing a lot of story, we're killing a lot of passion and the future. So you are not only doing this for yourself, you are doing for a lot of people. They are afraid to stand up and fight for their life. For me, I don't see any excuse to stay on the couch waiting someone to fix your life. This is not what intended me.
No.
But at least I'm happy to connect with the people like you, have the protests, and they do all the work which we need. Keep going, Audrey, and I'm happy of your interview. To be honest, you mentioned a lot of the things I never thought will be exposure on the media. It's not media on the online, but yeah,
Yes.
it is the reality. It is a reality. So I know because this is the reality. How brave you are to mention this in front of everyone. Thank you.
Oh, it's been my pleasure. Thank you.
Thank you. Bye-bye.
Bye. You say bye too, Baxter.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Certiat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Certiat.